with Sheehan Natural Health Improvement Center, and I am a clinical nutritionist. This is my husband, Keith Sheehan, chiropractor and clinical nutritionist. And we're here today to tell you about what is functional medicine. First off, I want to tell you a little bit about my story. I started off as a patient for my chronic health problems when I was in my early 20s. I had severe recurring infections, urinary tract infections, and yeast infections. Now, these infections, I tried to get them treated conventionally. The drugs that I got for them just made me worse. They didn't get rid of, put it this way, they give me symptom relief for whichever infection was being treated, but then the other infection would come on with a vengeance not that much longer afterwards, and it was just like playing ping pong back and forth for about 3 years. So I started seeing Dr. Sheehan in 1998, and I saw him for my neck. He fixed my neck pretty fast, but he also said, I think I can help you with these nutritional issues that you're having. So I went into his office. He had me hold out my arm like this. He pushed down on my arm. He said, you have an immune system issue. Oh, I guess he tested different reflex points on my body as well. And he's like, all right, you have an immune system issue. Now just take these herbal drops. So I took the herbal drops. First of all, I was like, whoa, what is this? I've never seen this before. I've been trying to fix myself using natural homeopathy, herbalism, all kinds of different things for years, and I've never seen this. I've never seen anything like this. I thought I knew about things. Turns out I didn't know as much as I thought I did. And
isn't that always the case?
It's always the case. That's why it's important to have an open mind. So I took the herbal drops. Within 2 months, my infections were completely gone. They were gone. Now, I did have one very tiny recurrence of the urinary tract infection about a month ago, and I don't know why, but I'd say one recurrence in 20 years.
That's pretty good.
That's pretty good. So basically I was cured, and I thought, this helped me, nothing else helped me. This is what I'm going to do for my health. So it has nutrition response testing, and that approach has stood me in very good stead for many years. That was 20 years ago.
Yeah.
And
21
years ago. Time just keeps marching by. So I have another piece to this story, though, and that is last year I went to go get a full blood panel. Keith and I were like, we're always trying things out on ourselves because there's a lot of stuff out there and we feel we need to sift through it,
right?
Find what's usable for people. And we got comprehensive blood panels done, and I looked at my results and I said, whoa, I have high iron. I was like, what is this? Now, it wasn't my serum iron that was high. It wasn't my ferritin that was high. It was my total iron binding capacity that was low, which means that the proteins in my blood that carry iron around, they were not they weren't full, but they weren't really being sticky to iron. And that means I have a lot of iron. So I thought, what is going on with this? So I took a genetic test.
Mm-hmm.
And a genetic test.
Oh, yeah.
And I got the result back that I'm actually a carrier for one of the genetic mutations that can cause what's called hereditary hemochromatosis, which is an iron overload disease. It's a genetic iron overload disease. It's relatively common among Caucasians. And
how common?
1 in 9.
1 in 9?
1 in 9 is a carrier.
Mm-hmm.
People that have full-blown disease, there's a bunch of different genes involved, and nobody knows exactly.
It's roughly around 1 in 200.
1 in 200.
Yeah.
Okay.
So it
actually develops the disease full-blown.
Hemochromatosis?
Yes.
Yeah.
So here it turns out I've got what Keith calls the Thrifty Gene, and that my body just genetically holds on to iron better than it really should, actually. And there's various theories for why that might be so common in our population. But I did what you're supposed to do for that, which is go give blood. So I went and I gave blood. I did it several times. And after every time I did it, I felt better. I had been having a bunch of different symptoms. I had been having depression, fatigue. I was having joint pain, especially shoulder pain, neck pain, wrist pain, and knuckle pain. My calves were feeling like they were swollen, like balloons. And I had a lot of ovarian, actually I remember I had a lot of ovarian pain.
Yes, we thought you had a hormonal
I did.
problem, but it never came up when I scanned you.
No, I had a lot of pain in my left ovary all the time. And I also was developing spider veins that were sore. I had a throbbing sore varicose vein in my foot. And after I gave blood, I would say all of those things resolved at least 80%.
Yeah, at least 80% better.
Yeah, I'm much better now.
Yeah,
much
kind
better.
of incredible.
So that just got me to thinking, well, what is up? You know, what? I mean, kind of like, why didn't nutrition response testing pick up this iron overload thing? But that's hard to really check for with nutrition response testing.
There's no point.
Unless you really know, unless you're really digging for that specific problem, you're not going to find it. So
you're not. I've been doing this for a long time. There's certain major problems that we have in our society right now, which are blood sugar issues. Well, one in three people are pre-diabetic or diabetic.
Yeah.
Most of them don't know it. The autoimmune diseases, there's no point on the body to test with muscle testing for that.
Right.
And there's also not a specific point for iron overload,
right,
which is very, very important. Sorry to interject, but that's actually the reason why I got into functional medicine. But go ahead, you can continue with it.
That's a really good point, because it gives us another very important tool that we can use as assessment to see what is going on. Do you want to tell your story with functional medicine?
Yeah, I can tell my story. I mean, I started off with nutrition response testing. Well, even before there was nutrition response testing, there was other muscle testing technology that I used. And I started that off in 1993. And then I started practicing, on patients in 97. And I always did very well, but in the past 20 years, we've noticed that there's been this huge uptick in diabetes and prediabetes. I mean, I think it was like 1 in 10 back then, and now it's like 1 in 3. I mean, it's like totally escalating with prediabetes and diabetes.
Wow.
And autoimmune disease, when we were in school, we were like, you're not going to see much of this. And now it's, how many people have autoimmune disease? You do the little stats.
Well, I know how many people have chronic disease. It's 4 in 10.
Yeah, 4 in 10. It's something like that.
6 in 10.
Yeah.
Sorry, 6 in 10.
6 in 10. So it's a very huge number. And then there was also, then we learned about the iron overload. Okay. And I found that basically muscle testing does great in getting people feeling better and for what's called functionally ill, which means that the person has nothing on their blood tests, but something shows up, when we scan their body. And it's also very good for chiropractic, for getting you to hold your adjustments, get out of pain and stuff. But the functional medicine was needed to go the next step. Also, as another reason why, is that my mother has had, blood sugar issues, pre-diabetes for probably 20 years, and it runs very strongly in her family. And her doctor said that you don't have to do anything about it. And one of the things that is associated with pre-diabetes and diabetes is Alzheimer's, which is, of course, on a huge surge. I mean, it's one of the major causes of death in this country right now. And she developed Alzheimer's, and I look back and she had all these numbers pointing towards it for years. I remember her telling about that like 20 years ago. So I've also had a number of patients come in that with nutrition response testing, they would get better, but they wouldn't get all the way better. And I would run blood tests. I mean, how many people have you heard me say, you run blood tests and like, oh, I found out your problem, you're pre-diabetic. Or I found out your problem, you've got a raging autoimmune disease that, that your doctors haven't tested for. Or how many people, come in and I'm like, oh, you've got iron depositing like you.
I had iron, yeah.
So I found that it was a necessity. So instead of just doing nutrition response testing, I was like, I got to start doing this functional medicine. Otherwise, a lot of my patients aren't going to be served properly. The other thing is that what I found is that a lot of people, they don't have enough faith in just doing a muscle test. And they need something black and white. And what's more black and white than a blood test? I mean, it's like, you either have it or you don't.
Right.
You know what I mean? I mean, I don't have to say I think anything. I'm like, your blood says this, and it's not supposed to say that.
Right.
So that's the reason why I started doing functional medicine, and I found that I used to think there wasn't much information on blood tests because that's, people say, oh, the doctors don't find anything. But I mean, there's a huge amount of information on blood tests. It's just you got to know how to read them. Right. It's very easy to read them too if you know what you're looking for.
Right, exactly.
So that's really the reason why I started doing functional medicine.
Yeah, so I just want to give a definition now of functional medicine. Functional medicine represents an operational system that focuses on the underlying causes of disease from a systems biology perspective that engages the patient and practitioner in a therapeutic partnership. That's a definition from Jeffrey Bland, PhD, who's a pretty well-known nutritionist. I also like the definition of functional. It's a medicine involving physiological function rather than anatomical pathology. So I want to make that clear distinction is as functional medicine practitioners, we do not handle the pathology. There are other professionals who are, trained and it's within their scope to handle the actual pathology. Mm-hmm. We are looking to increase physiological function and to remove the things that are keeping that function from progressing normally. So, for example, if you look over here at this chart, organ dysfunction, will that keep your body from functioning normally if you have an organ that's not kind of working exactly right or is a little stressed? Yes, it will.
Right. Nutritional
deficiencies. If you have an organ that needs certain vitamins and minerals, but it doesn't have them, do you think that that's going to affect its function? Yes, it will.
Yeah.
Toxicities, will those affect your body's function? Absolutely. What can find all these things is functional medicine. You will find either directly or indirectly evidence for nutritional deficiencies, organ dysfunction, and various toxins on your blood tests. We also do other types of testing as necessary, so urine tests or hormone, saliva, different types of things like that.
Yeah.
Primarily blood, though.
Sometimes we do digestive tests, but quite honestly, they're so easily handled with nutritional response testing and diet change.
Right.
Yeah.
Right. So it's going to vary on the particular case exactly what types of tests are done.
Mm-hmm.
So, do you think that if you're coming in with a certain problem, say the person has a thyroid problem, and they know they have a thyroid problem, and they come in to see us for help, is there going to be an organ dysfunction? Yes. Are there going to be nutritional deficiencies? Yes. Will there be toxicities? Yes. It's called, usually especially in autoimmunity, it's called the autoimmune trigger. Something that keeps that situation perpetuating in the body.
Yeah, and thyroid is like a really important case because of the fact that people say they've got a thyroid problem, and what they mean is actually 90% of cases of thyroid dysfunction are a thyroid symptom. In other words, the thyroid is being attacked by the immune system, and it's not a thyroid dysfunction. So you actually have to fix the organ dysfunction, which is the immune system, and actually to get the thyroid better.
Right.
That's a good point.
You have to have the proper target.
Yes.
Right. So all those things are determined through functional medicine, and then we use safe and natural therapies to start to make a change.
Right.
Get the body to stabilize, get the situation to stabilize, and in many cases improve.
Mm-hmm.
So that's what we do with functional medicine.
Mm-hmm.
Now, it's important to note that overall health is our focus.
Mm-hmm.
So we're going to be looking at how do we get this body to heal, but we're also going to be looking at what is going to support this body's healing process overall over the long term.
Right.
And there are 4 main things that do that.
Right.
Diet is the big one. Well, some people would argue that sleep is more important than diet.
Right.
Some people do argue that. And then there's also stress reduction.
Yes.
And exercise.
Yes.
And those are all very important. There was actually a book written, I think it was called The 4 Pillars of Health, and it was written by a doctor who has his own functional medicine TV show in England. We don't have a TV show like that yet in this country.
We don't have that in this country.
But in England they do, which is very interesting.
Mm-hmm.
So everything we use is safe and natural. It will enable us to help you if you have a diagnosis or disease or if you're currently taking other medications. And it allows us to help the young and the old alike. So we've seen many different people with many different types of issues looking at their various laboratory results. And I would say, can functional medicine help you? Well, there's some conditions that are very well supported by functional medicine, in some cases even reversed. Interesting that you can reverse the condition without treating the condition. That's very possible.
Yeah.
Diabetes and prediabetes, thyroid disorders, autoimmune disorders, digestive disorders, chronic fatigue, immune system problems, and infertility. Okay. So, anything to add, Dr. Sheehan?
No, I think that would be about it. Hopefully this explains what functional medicine is and isn't. And in the next video, we're going to go over common complaints that we see improve with functional medicine, common questions, and what to expect on your functional medicine visit.